Can you guys talk more about the specific challenges that adolescents with epilepsy face when making the transition to adult care?
So there's a few. As Dr. Beimer mentioned, probably the biggest challenge, I think, from a purely medical perspective, is that they go from a pediatric model of care to an adult model of care, which is just kind of conceptually how it is handled, how the clinics are structured, how the conversations happen are just different because you're in pediatrics on one side and adult on the other side. And so I think that's one big challenge where it's not uncommon to have conversations with parents along with the adolescent, whereas the adult model of care often is having conversation with the patient first and caregiver second. Some of the challenges that we have seen in transition are navigating the world outside school, which is again highly structured even when it's in high school, and all of a sudden it's the big wide world to navigate. There are challenges to transition because some of these adolescents leave home and go away, whether it's for work, whether it's for school. They have to figure out managing their medicines, filling their medicines themselves, particularly if they are away. So I think there are a lot of challenges that there are in transition. And definitely, as a medical system, there's a lot of emphasis on that now. And I think there is more awareness on the provider side to prepare this cohort of patients to successfully navigate the world of adult medicine. But I think Dr. Beimer and I, we both came from we came to the same meeting of the minds, but from two sides. Is a lot of times the transition process is really a transfer. It is just writing a referral to an adult neurologist and say, off you go, without really understanding what all needs to happen to prepare them to make that jump, so to speak. And this was one attempt to understand who is ready, how they are ready, and if they are not ready, what should be done. I mean, obviously this study and this paper did not accomplish everything because this was really our starting point. But that's the goal, to see, what can we do to make these transition readiness scores improve in a longitudinal fashion.